My name is Corinne Knudsen. I'm the Chief Development Officer for La Maestra Community Health Centers.
Dr. Elisa Nicholas, CEO and a pediatrician at the Children's Clinic serving children and their families.
My name is J.W. Lee, Chief Medical Officer at Venice Family Clinic.
I'm Leah Canvasser, Chief Administrative Officer for Marin Community Clinics.
My name is Tu Quach. I am the Director of Community Health and Research at Asian Health Services.
My organization has realized the importance of social risk factors in the health and well-being of our families. But most recently, we've begun screening for food insecurity, housing insecurity, and exposure to trauma. PRAPARE has allowed us to integrate this more fully into our organization. And we now have 20 CalFresh enrollers trained in our organization because we found so much food insecurity.
Marin Community Clinics was really interested in digging more in with PRAPARE to start to get metrics to see where we could improve our offerings to our patients and strengthen our community tie to see who we could work with closer to bring better care to our patients, not only in a healthcare specific setting, but reaching out, looking at things like the social determinants of health that also affect our patients' healthcare.
Asian Health Services was actually involved in some of the early discussions that led to the development of PRAPARE. So when we had the opportunity, we participated because we were one of the few clinics that serve a lot of Asian Americans who face language barriers. So it was important for us to test out the PRAPARE screening tool for the limited English proficient population.
We're definitely learning that our patients are willing to provide the information to us and that PRAPARE is a very valuable template and very comprehensive. We're learning that while we had assumed many more patients would have needs of housing and transportation, we're noticing that less than we originally assumed need those services, but actually those that need services, their needs are immediate and very severe. So we're working on addressing and responding to those needs more quickly.
We are uncovering things that we weren't aware of that were going on in the patient's life that could be quite significant, whether that be unstable housing or food insecurity or exposure to violence or danger in their community. These are things that may not come up during the course of talking about someone's diabetes or some cold or a knee pain that a patient may have. And so this just gives us a process by which we are routinely asking these questions and listening to the patients. And the staff have felt that this is very aligned with what we're doing as a clinic because they kind of got into healthcare, not just do the medical piece, but also care for the people that come through the door.
So having this concrete data will allow us to really design programs and to show payers and other funders that there is an immense need for addressing upstream social determinants of health and providing social services, and that whole person care isn't just health care. It's also access to food, access to housing, access to clothing. So by having this data and having it in a more accessible format, we really think that we'll be able to design more responsive programs and to really have the patients guide these programs.
I think the big thing for us is really using the data to help drive building partnerships with community agencies that can help address some of these needs and concerns. Oftentimes there are things that are outside our scope of ability to affect, and as a clinic we have to have both the wherewithal and the humility to be able to ask for help from others in the community to reduce the negative effects of some of the social determinants of health.
I think for our patients, it's important for us to develop workflows in which we are not just screening, but trying to respond to them and really being able to develop and train up our staff on how to respond. And overall, I think being able to feed the data back to our leadership to really emphasize the community concerns so that we can take action on issues. And then also understanding that for community health centers, we've been so comprehensive in how we respond to our patients' health issues. That includes a lot of these social risk factors. So it's important that our payment doesn't just look at the direct cost of medical services, but really a lot of the enabling services that we do so much of.
I think that using the resources from CPCA and National Association of Community Health Centers, NAC, and APCHO to go through and actually work through all of the workflow templates was very helpful to our team and to asking the questions both of frontline staff and of patients before making the PRAPARE template live and rolling it out to all of our patients in our health education department.
Make sure that your staff is ready to administer these, because sometimes they'll find out things about the patients that can be triggers for them. And it's important to realize that if you're asking about domestic violence and you have been a victim of domestic violence or grew up in a home with domestic violence, this may be hard for your staff to do. I think the other is make sure you have the training of your staff to respond to the issues they're going to reveal. And the third is to have the resources to address the issues both within your organization or referral sources into the community.
I think the biggest thing would be to embrace it as a way of understanding the patients that you're serving better and to use it to fuel, improvements in the way that you deliver care. It means that we're upping our game in terms of being able to help our patients in a meaningful way versus feeling frustrated that we're not able to meet all of the patient's needs when they come through the door. Really learning from other clinics in terms of what they're learning about their communities and hearing about best practices for how to address some of these issues and being open to that. And I think that really will help all of us really continue to build on the great foundation of the mission that we all share, which is to, provide great care to our patients, because it'll help reduce inequities that we witness every day.
I would say that it's really a great opportunity for staff to come together and empower themselves and feel empowered in how they're helping the patient, not only just in lab results and taking down that basic information or detailed information. It's allowing them to really feel like offering a whole level of care to the patient.
I think it's important that if anyone is to adopt PRAPARE, not to see it as one project, but really a change in how we start screening our patients and adopting it in a way that fits in with the various workflows of our patients.
I would just say it's been a fantastic opportunity. In the beginning, there may have been a bit of hesitation due to, just one more thing to ask questions about and one more thing to implement. But really, we've, in this short period of time, have seen great outcomes from this. And I would really encourage other groups to not be afraid to step in and start working on it.
Really make sure that this is something that is owned by your staff, that it's not something that senior management is bringing down on people and adding to the work burden during the day. If you can frame it as something that is really going to make a difference and that we're relying on our staff and the people on the front line to understand these issues better and to bring them to light and bring them forward to the providers who are planning the patient's medical care, that can only energize the work that we do. And I think that really truly creates engagement, and it also creates a sense of the patient truly being taken care of as a whole person.